for joining us today for this gun violence prevention roundtable. We are in gun violence. We are in Gun Violence Prevention Month. Sadly, people don't need a reminder now of the ongoing violence that we're experiencing in our communities, and of course, mass shootings as well. And the key is to turn Gun Violence Awareness Month into Gun Violence Prevention Month, and then make sure that we focus on that month after month, day after day throughout the year. Before I make a few opening remarks, I would like to introduce those who are with us today on the panel, starting with somebody who helped organize this event, which is State's Attorney Aisha Braveboy, State's Attorney in Prince George's County, who we work very closely with on these issues. Thank you for your leadership. Mr. George Hodge, who's the president and founder of Community Kinship Coalition. Thank you very much for joining us. Dr. Joseph Richardson, who's the chair of African American Studies Department at the University of Maryland, College Park. Thank you for being part of this conversation and for what you do. And Ms. Liz Bannock, who's the executive director of Marylanders to Prevent Gun Violence, who's also been working on these issues nonstop. Thank all of you for being part of the panel. Thank all of you who are joining us. We have seen a upswing in gun violence. If you look at last year, 2020, it was one of the deadliest years on record. An estimated 19,300 Americans killed in gun homicides or non-suicide related shootings. And if you add in, of course, the devastating suicide loss, it goes up much higher. The increase in gun violence from 2019 to 2020 was one of the biggest jumps we've seen since the year 1960. Maryland has not been immune. In 2019, the most recent information that we have, 757 Marylanders died from gun violence. And between 2014 and 2018, there were 42 mass shootings that claimed 45 lives and injured 156 others. In fact, tragically, gun violence has become so routine that if the pattern continues, by this time tomorrow, two more Marylanders will have lost their lives due to gun violence. It tears at all communities, but especially communities of color, and exacts a daily toll. And that daily toll is especially harmful to our youngest among us. So we've got to do a number of things, and we're going to have a conversation today about what we can be doing in terms of gun laws, but also community action and programs. One of the things we know can be very effective is to require permit for purchase laws for handguns. If you look at research done by Johns Hopkins University Center for Gun Violence and Prevention Policy, they show that states that have adopted these policies see a decline in gun violence and deaths by gun. And that's because under those laws, somebody has to go to a law enforcement designated entity and show their ID in order to be able to purchase a handgun. And that, of course, deters people who want to do harm with their guns from doing it that way. However, Maryland and other states with permit to purchase laws are not islands. And that is why we've got to address this nationally. In fact, of the guns used in Maryland crimes that could be traced, 54% came from outside the state of Maryland. And almost all of those came from states that do not have permit to purchase laws. I was pleased that President Biden in his budget included funds to encourage other states and localities to adopt these laws. That tracks with legislation that I introduced and have for a couple years. And I asked Attorney General Merrick Garland at a hearing the other day to also come up with model state and local laws that could be used for that purpose. We also need to make sure the Bureau of Alcohol, Tobacco, and Firearms is not handcuffed in what they can do. We have laws that have been put in place at the federal level that make it much harder for them to do their job in tracking down guns that are used in crimes and in cracking down on rogue gun sellers, retailers, and others that knowingly sell or negligently sell to criminals and those who want to commit guns or commit crimes. So, for example, ATF is currently barred from creating a database to help track crime guns quickly. Sharing trace gun data on firearms with the public is prohibited by law, and requiring gun dealers to keep accurate inventories is also something that the ATF cannot do under law. So we've got to deal with this. I've introduced legislation to modernize the ATF to get rid of these limitations. In the meantime, I am pleased to see the president in his remarks yesterday indicating that he is going to urge ATF to really use all the powers at their disposal to begin to get at some of these things. So some of it will require legislative changes, which we're working on. But if you have somebody leading the ATF who's knowledgeable about these issues, that can make a big difference. And that's why I was pleased to see the president appoint David Chipman to lead the ATF. I spoke to Mr. Chipman yesterday. We're hoping his confirmation will come soon because the opponents of gun safety laws have tried to essentially decapitate the ATF by not allowing there to be a person at its helm. But we know that these laws and these actions can help cut down on straw purchasers. The president made some announcements yesterday. We can talk about those, but they were very important steps to take in our national fight for gun safety. And they took earlier steps as well, dealing with ghost guns, which we're seeing more and more of on the streets. Finally, I want to close by saying, in addition to efforts to prevent the sale of guns and make sure that we get prevent the sale of guns into the hands of people who are going to use them to do harm, we also need to focus on community-based gun violence prevention. And I'm really pleased that as part of the American Jobs Plan the president's proposed, as well as the budget, they've asked for resources there. And one of the things we also want to talk about today is how those funds could be best spent in our communities for gun violence prevention. And finally, of course, nothing takes place in a vacuum. We have to address a whole range of other issues in our communities, dealing with an uneven playing field when it comes to opportunity. Everything from universal early education is necessary, more investment in our public schools, creating more work training opportunities. And I'll just point out that if you look at the two big pieces of legislation President Biden and Vice President Harris have proposed, the American Jobs Bill and the American Families Plan, they have large investments in a lot of those other important areas to help our communities at the grassroots level. I don't want to go on any longer. Let me turn it over to State's Attorney Braveboy for some opening comments, and then we'll open it to our conversation.
Thank you very much, Senator Van Hollen. And it's such an honor and privilege, not just to be with you today, with this esteemed panel of experts. In my job, it is devastating the families who I have to meet who have lost loved ones who are absolutely very, very, very young to gun violence. In fact, my office right now is in the process of handling a case involving a 13-year-old who died as a result of a shooting by a 12-year-old. So if you can imagine how difficult it is for us to really look at how do we seek justice and how do we ensure that the individual is held responsible for a very serious, the most serious crime, but also recognizing their youth and the fact that there were probably many issues that led to that violent act. And so what our goal is to prevent these types of acts from happening, because they're devastating to families, they're devastating to our school children, because one day you have your classmate there, the next day they're gone. And for children to have to deal with that, the trauma of losing a classmate to gun violence, no child should have to deal with that. And so what we know is that gun violence has increased around the country, around the state, and in Prince George's County. We're seeing young people engaged in gun violence, in particular carjackings. Our carjackings increased from 2019 to 2020 by over 180%. So we saw a huge increase in carjackings. And many of those carjackings, the suspects in those cases are juveniles under the age of 18. So some as young as 12 and 13. So if you can imagine a 12 or 13-year-old who has a gun, who has confronted someone, taken their car, and is now driving on a roadway, they are not old enough to even have a license. So not only did they endanger the victim, but they endangered themselves and every single person on that roadway. And so this issue of gun violence, and especially dealing with carjackings, is a huge problem here in our region. We are a part of a regional task force headed by the U.S. Attorney's Office in Greenbelt. We also have a local carjacking task force that my office heads along with the county executive. And we have included in that task force a number of community stakeholders, including nonprofit individuals, businesses, as well as our law enforcement partners, because we recognize it's going to take a holistic approach to address the issue of carjackings. But included in that now, we have a committee dedicated to guns and gun violence, because we have seen an increase in the use of guns in serious crimes in our community. And one thing that the senator mentioned was ghost guns. I can tell you, Senator, and everyone else listening, that in 2020, our police department recovered 43 ghost guns. In 2021, year to date, they've recovered 117. So we know that ghost guns, are these guns without serial numbers, which are really difficult, if not impossible, to trace, are really showing up in a lot of our cases, as well as in a lot of our gun recoveries on the streets. So it's really important that we work along with our federal partners to have very strong legislation around ghost guns. But I will say that we work very closely with our departments, all of them. We have about 26 municipalities in Prince George's County, so we work with every single municipality, their police departments, as well as Park Police, Metro Police, and in our FBI and ATF. So we have a very strong working partnership with all of our law enforcement partners. But what we believe will make the difference will be a serious engagement with our communities, which is why I'm really excited that the senator wanted to bring us together today. We will do our part on enforcement. We can certainly use additional federal resources for that, but it's not just enforcement that's going to really address this issue. It's enforcement, it's intervention, and it's prevention. And many of you on this panel really can be partners with us, especially on the prevention side. And that's what the task force that we're putting together here at the county level will always include partners who can help us with prevention, because that is the key. Not only do we look at gun violence as a public health issue, which it is because we have young people dying, but it is also an economic issue, because those areas that are less wealthy in our community are disproportionately impacted by violent crime. So we know that wealth and opportunity is another key to ensuring that gun violence does not overtake and overrun communities. So again, Senator, thank you so much for hosting this panel, and I look forward to the conversation today.
Well, thank you, and thank you for your good work as state's attorney. And you mentioned some of the ongoing local efforts, and why don't we now turn to Mr. Hodge, because I know he's been focused at the community level on things that we can do to prevent gun violence. And maybe you can talk a little bit about what you think works, what doesn't work, and what direction we should head. I think you have to unmute yourself.
Can you hear me?
Yes.
Thank you, Senator Van Hollen and distinguished panel. It's an honor to be on a panel with you all. For the past 30 years, I've been an educator and youth advocate, working with youth and families in Prince George's County, as well as in the District of Columbia. And I'd like to start out with this, I have to say this. I personally know about what gun violence can do to families and especially children. Back in 1994, I lost 3 relatives, a nephew and 2 cousins in the same year. And it was devastating. It traumatized my family, but it was the catalyst for what I started to get involved with in terms of the community, with Community Kinship Coalition as a anti-violence program, using a mere basketball to draw kids to a recreation center, moving from 65 kids now to about 5,000 kids we've had the opportunity to have a positive impact on. And I'll say this, the future of our state and the nation will be defined by the mental stability and moral foundation of our children, as well as those generations to come. We need more legislation passed by our elected officials and congressional leaders for funding in 3 specific areas. Education in our schools in the areas of restorative justice practices and conflict resolution. Intervention in terms of mental health intervention for our students and our young people in the community who grow up to be adults. We definitely need the intervention when it comes to the mental health counseling, and they're crying out for it. These interventions must spill over not only in the schools, but in the community organizations that specifically work with young people in our communities. We drastically need funding for that. And in terms of prevention, we need more funding in terms of community violence intervention programs, placing pilot programs throughout the state of Maryland, not just Prince George's County, but we need funding for these community organizations that deal with youth, nonprofits, as well as the collaboration between the schools and the community organizations as well. Back in the day, they had latchkey programs, before and after care programs, where these pilot programs need to be centered around nonviolent practices that's promoting, practicing, and teaching nonviolence to our young people. And, although I've used a basketball for the past 30 years to draw kids to my event, Community Kinship Coalition Hoops for Peace, the impact of having professional facilitators empower them and let them know that they can be accepted where they are, but the sky's the limit in terms of where they can go is essential. And whatever I can do to play a part in working with you all, especially now that I'm joining the task force with the Honorable um, Aisha Braveboy, our state's attorney. I look forward to doing whatever I can do to assist in this essential matter. Thank you.
Thank you. Thank you, Mr. Hodge, and thank you for all you're doing with the Community Kinship Coalition to try to, prevent other families from experiencing the kind of tragedy you did as a result of gun violence in your family, and for mentioning, that all of this takes place within a certain context, and we do need to focus, as you said, on those issues of education, mental health, and then programs that are targeted specifically toward interventions and nonviolence. And Dr. Richardson, I know you've done work in the area of the trauma caused by gun violence. So maybe you could just talk a little bit about your work, and then maybe connect it up with some of the other issues we're talking about regarding the best way forward.
Sure, great. So thank you again, Senator Van Hollen, for inviting me, as well as State's Attorney Braveboy and the other esteemed panelists. And thank you for your comments, Mr. Hodge. So just to give you a brief overview of my work and who I am the co-founder and founding director of the Hospital Violence Intervention Program at the University of Maryland Prince George's Hospital Center, which I founded in 2017 and directed from 2017 to 2019. For those who don't understand hospital violence intervention programs and what we do, when someone arrives at the trauma center as a result of being injured by a firearm or other penetrative injuries, such as a stabbing or an assault, we are the front line who approaches those survivors of violence at bedside, and that's where our relationship starts. And once we are able to establish trust and rapport, which is established by a violence intervention specialist, and that's typically a staff person who has the lived experience of being violently injured and may also have the lived experience of chronic exposure to violence and criminal justice involvement that has turned their lives around. We start as that and get those in cycles. One of the primary services that we offer are mental health services, because what we find is that a significant number of the people in for warranted reasons who have been injured also suffer from symptoms of traumatic stress. And those symptoms, I would like to also make clear, do not start at the time of the injury. Trauma often is continuous over the life course for many people who are survivors of trauma. So those symptoms you would find among individuals that have been injured, you often see among those soldiers who are engaged in combat. Very similar symptoms: hypervigilance, hyperarousal, anxiety, and significant distrust, anger, and irritability. And so we start that process at bedside and provide psychosocial services. And just to give you an example of the success of these programs, over a 2-year period, we provided services for 116 participants in the program. Over that period, only one person returned to the hospital for a violent injury. Now, if you look at the national statistics on trauma recidivism, the trauma recidivism rate can go as high as 60%. I mean, 6 out of every 10 people that come into the hospital, this is their second, third, or fourth time being injured. And they often are victims, but they often could be offenders as well. So to have 116 participants and only one person return to the hospital, if you do the math, it's less than a trauma recidivism rate of less than 1%. But I also have to say that that program was staffed with 3 people. The number of people who come into Prince George's Hospital Center every year, according to my most recent analysis in 2020, is 794 individuals that have been injured with a staff of 3 people. So clearly, the budgets for working with this population needs to be increased. And we have funding. I serve as an advisory council member for the Maryland Violence Intervention and Prevention Fund, which I'm sure Liz will talk about in much more depth. But we have advocated to the state Senate as well as to the House of Delegates in terms of Governor Hogan's veto of the Violence Intervention and Prevention Fund, which was primarily used to fund programs like the Capital Region Violence Intervention Program at the University of Maryland, Prince George's Hospital Center. So I just want to just provide, to put into more context, some statistics in terms of non-fatal shootings, and I'll specifically focus on Prince George's County. In 2019, there were 193 non-fatal shootings. In 2020, there were 295 non-fatal shooting incidents. And in 2021, in just 6 months, there are 175, which puts us on pace for almost 350 non-fatal shooting events. And as I said, this level of community trauma not only affects the individual engaged, but it also affects communities and families. And as I mentioned, those symptoms of traumatic stress affect everyone. So as Mr. Hodge mentioned, we need far more mental health resources that are accessible in communities, but we also need community violence intervention strategies that are on the ground. When I started this program in 2017, there was a Cure Violence Safe Streets initiative in Prince George's County. And those are violence interrupters that intervene before the violence starts and are evidence-based and have been proven to work. When I started the program, that Cure Violence program was defunded. And it was existing in the Prince George's Department of Health. So again, the level of investment that we need in these programs is considerable. The average cost of someone being injured can go up to, from anywhere between $50,000 and $500,000. Gun violence is a $200 billion cost for gun violence in this country. And so when we look at the number of homicides in Prince George's County, which as of May 30th are 56 homicides, last year, May 30th, 2020, we were at 30. That was an 87% increase. Baltimore right now, we're at 162 as of today. And the Shock Trauma Center, where I currently do my work in Baltimore at the University of Maryland, R. Adams Cali Shock Trauma Center, where I'm the research director there for their hospital violence intervention program, we treat 1,400 victims of violence every year. And you can imagine the staff is no more than 10 people. So again, if you just look in terms of scale, the way that we're funding this problem in terms of the cost, we're totally out of scale. And I would just advocate for additional funding from the state to address this issue.
Well, Dr. Richardson, thank you for that sort of firsthand frontline account of a program that's in action and a program that has shown the success that you talked about in terms of the numbers, but also a program that's under-resourced. And I think there should be greater investment of state money. And I am pleased that President Biden's proposal at the federal level calls for investments in these areas. And one of the reasons I wanted to have this conversation now is we'll be in the process of trying to shape some of those community-based violence prevention programs, how the federal dollars flow. And we want to make sure that they are done in the most effective way. And that brings me to Ms. Bannock, who has been working on these issues for a very long time. And as Dr. Richardson mentioned, has a sense of the statewide programs that are in place and what might work best and what may not have worked as well, so that we really can concentrate our efforts to reduce violence. So let me turn it over to you, Ms. Bannock. Liz.
Thanks, Senator Van Hollen, and thank you, Madam State's Attorney Braveboy and Dr. Hodges and Dr. Richardson. As Dr. Richardson noted, in addition to serving as Executive Director of Marylanders Prevent Gun Violence, my other hat is I co-lead the Maryland Violence Prevention Coalition with Greg Jackson, who is the Policy Director for the Community Justice Action Fund, which is a national organization that works to address the intersection of criminal justice related issues and gun violence prevention. Certainly, Madam State's Attorney and Dr. Hodge, I'd love to talk to you all at some future date about involvement from your offices and our coalition. The coalition was instrumental, and I owe a lot of credit to Dr. Richardson in establishing the Maryland VIP Fund. This was a fund that was created to fund these programs that you all have talked about that provide support to violence intervention programs. That program has effectively been defunded, as Dr. Richardson stated. And the coalition has been working to make sure through legislative efforts, through education, to make sure that that funding is reinstated. Honestly, I think President Biden probably said it best. Don't tell me what you value, show me your budget, and I'll tell you what you value. And that's so true when it comes to this type of work. This work, a lot of people are doing it on a shoestring budget, but it can't be done without any support at all. And this is what we know. We know that in 2016, the 1,672 shooting deaths in Maryland had direct measurable cost of $1.3 billion to Maryland. And research has shown that for every gun-related homicide in this country, we spend $488,000. So that means if we invest $1 million in these programs that we've been talking about today, and we saved 3 lives, then we've saved money. And I don't think there's a lot that folks can agree upon in Washington, but I think being able to save lives and save money at the same time should be one of them, right? And we have really clear evidence that these types of violence prevention models don't just save lives, don't just save money, but they save lives. In New York, we've seen, like, with implementation of programs, there have been 60% reduction in homicides, and that's significant and important. And I think that with Gun Violence Prevention Awareness Month, you know, it is important to have the sort of a show of support, the wearing of the orange shirts, and but once the lights are turned off and they're no longer orange, we need to make sure that that commitment remains, that the programs are there, that the funds are there to support the programs. And I'm very, very pleased to see, you know, President Biden's promise of $5 billion to community violence intervention programs, and the efforts that Senator Van Hollen's office has supported. And I think we just need to make sure that our leaders continue to be committed to these efforts, that they continue to be invested. And in states like Maryland, where, you know, advocates had made really good progress, and we were on the precipice of being leaders in violence prevention, that we hold those who have taken those funds away from us, who have diverted those funds, accountable, and that we make sure that that we continue to invest, that we continue to support this evidence-based work. There's evidence that clearly shows this early intervention is so crucial to the later prevention of violence. And again, $2 now saves $7 down the line. This is important. So if you don't, I tend to care about the life-saving aspect of it. That's what motivates me. But for other people, it's the money-saving aspect. And I think that whatever it is that motivates you, we need to sort of key into that with whomever our leaders are and make sure that we're invested in this.
Well, thank you. As you said, these programs, and Dr. Richardson spoke about one of them, can save lives. They can save dollars. I shared your disappointment that the Maryland funding was eliminated, but I am pleased that President Biden has proposed this important federal source of funds. Let me turn it over to you, State's Attorney Brave Boy, and maybe you could, talk about, and you did this already a little bit, but based on your experience, right, with the justice system, how we could shape programs to address, those most in need of intervention in order to save lives and save dollars. And then I invite you to ask questions of the panelists as well that will help inform your work.
Thank you very much. This is such a great conversation. I have written something down that each of you have said, so I look forward to following up with everyone after this. But as a response to the increase in gun violence, certainly as the prosecutor's office, we're going to do our job. We're going to keep our community safe. We are going to prosecute cases. But we also believe that we have a role in prevention and intervention. And so we started an initiative on June 1st called Our Streets, Our Future. We started it at the beginning of Gun Violence Prevention Month because we believe that it was important for us to send a very strong message that gun violence prevention is not just the job of law enforcement, but it is the job of all of us, including those in the community. So Our Streets, Our Future is really a call to action that says, you know what? These streets are run by the good people who live here and who want to create a life for themselves and their families. And so if we protect our streets, we can protect our future. If we love our streets, meaning we invest in our streets, we will invest in our future. And so it's really a call to action for everyone to do their part. And so we are recruiting mentors in the community. We are also holding events in those areas most impacted by crimes of violence. And so we have events scheduled throughout the summer and the fall. Our first event is actually tomorrow in District Heights. We're holding a community pop-up where we will have services, including employment services and health services available to members of the community. We'll also introduce ourselves to the community along with our law enforcement partners and community nonprofits who really want to intervene and help and give people an opportunity to pursue their dreams. And that's what this is really about. When people are committing these acts of violence, what they are doing is they're putting roadblocks on their future success. And what we want people to do in our community is know that they do have a future. That's the number one thing that we find with individuals who are committing these acts of violence is that they don't know their own worth. They don't know that they can have a successful future. They don't know that they can be whoever it is that they want to be. They don't have the tools to get there. And so instead of us saying, okay, well, we're going to lock you up and we're going to take you away from our communities because you are violent, you're creating a problem for us, which, in many cases we have to do for a period of time. But what we know is that these individuals do return to our community. So even if we do make these arrests, even if we do prosecute and get sentences, those individuals are returning to our communities. And we are also investing not only in prevention, which is the Our Streets, Our Future portion of this, we also are investing in providing for restorative opportunities for people who have committed offenses and who are behind the walls. So those who are in our prisons, we recently formed a partnership with the State Department of Public Safety and Corrections, and we have a pilot program that will launch in July. And that pilot program is for our emerging adults, those age 18 through 26. And what we recognize is that those individuals make up the majority of our violent crime offenders. So over 50% of individuals who have been arrested and are facing charges for violent crimes in Prince George's County are between the ages of 18 through 26. So those 8 years, that small, age group make up over 50% of our violent crimes, and over 90% of our homicide suspects are within that age group. So we really are targeting them, those who have committed serious offenses. They may be serving time, but we want to be able to provide restorative opportunities for them too while they are serving their time, so that when they return to our community, they're returning healthier and they're returning more focused and wholer, so that when they do come back, they can either get employment or they can run their own business. So we have an emerging adult program. That program, we received a very small a grant from the Department of Public Safety and Corrections to initiate that. But the goal is, again, to provide those interventions to people while they're in prison and help them to be restored. So when they return to our community, they don't reoffend. So we know that the state's attorney's office has a real strong role, because our job actually is to seek justice and to protect everyone in the system, including those who offend. And so that's why we have taken the lead to initiate these community-based partnerships focused on mentorship and development, and ensuring that people, their needs are being met. So we can identify, what are your needs? That's why we're going out to the communities most impacted. We're knocking on doors. We're inviting them to community barbecues. We are asking the question, what do you need? What do you need in your community? And then we're working to provide those services. But as was mentioned, funding is a huge issue, because there's not a lot of funding in prevention. There's a lot of funding in enforcement, but when it comes to prevention, we don't see that same type of commitment. And we think that if you put the money into prevention, then we don't have to spend as much as in enforcement, because those crimes are not being committed. People are not repeating the violence that they may have seen or experienced in their communities. So it is really important what the president is doing, and Senator, what you are advocating for, which is to put this money into prevention so that we can stop mothers and grandmothers and grandfathers and fathers from grieving because they lost a loved one, either to gun violence, or because they see their loved one going to prison. We want to prevent that as much as we can. And so these interventions, the mentorship that Dr. Hodge is doing, and Dr. Richardson, I love to hear more about your work, but this seems like the one thing that we all talk about, but we never put our money into, which is prevention, and it actually does work.
Well, thank you. Thank you, Madam State's Attorney. And I think let's just go with that question. So, for example, Dr. Hodge, you mentioned that your programs, and you mentioned, of course, the need for more investment in education, mental health services, and violence prevention. And I know that your coalition works on those things. So, for example, if you were to receive the resources that, the additional resources to help you do or expand your work, how would you use them? Because what would you do if, for example, if there were a grant available, federal grant that came to you to help address, violence prevention? How would you use those dollars?
Thank you for asking me that question, Senator Van Hollen. And I'm sitting here thinking, and I'm really feeling this, because I think there's a great collaboration between schools and community. And being in the education system for the past 25, 30 years, I've always believed that the two can work as one. And if we were blessed with funding like that, that collaboration would have to take place within the schools. I believe in educating the person to get to the student and involve the community at the same time. So starting pilot programs centered around prevention and education and nonviolent practices. We have to start at the elementary school level to middle school level to high school, and track each and every one of those students till they get to their senior year in high school, and have them co-mentor one another, because that's not only creates a positive school climate and cut down on the negative behaviors in the school, but it spills over into the community. And if the community and the schools are on the same page, it creates great things for young people to just pursue whatever they want to do in life. I still believe that young people don't grow up and they don't sit around thinking about being drug dealers and committing homicides and abusing people. I think that children are pure at heart and they still dream about being a Senator Van Hollen, a Dr. Richardson, Elizabeth, Miss Brayboy. I think they still grow up wanting to be successful people. So if we can put those interventions in place and track and monitor these young people, that would be a fantastic way to have an impact on our young people with funding like that. Thank you.
Well, thank you, Dr. Hodge. And Dr. Richardson, you mentioned the program you're involved with, the hospital-based program, and I think provided important information about how that could be scaled up and effective. So with that would be, I guess, your first use of funds if they became more available to you to scale up that program. And based on your other research, first of all, is that the case? And then are there other areas where you also think we should be focusing sort of community dollars to prevent violence?
So definitely, if I had in an idealistic world, can wave a magic wand and have as much money as I wanted to address these problems, I would definitely start with scaling up the hospital violence intervention programs across the state. So not exclusively focusing on just the University of Maryland shock trauma and University of Maryland Prince George's Hospital Center, but Hopkins and all the other level 2 and level 3 hospitals around the state and scaling those up. And other states have done it. Virginia now has funded 7 hospital violence intervention programs, and I believe New Jersey has funded 9. So some states are investing in the medical systems in terms of scaling up hospital violence intervention programs. But I would also invest in community-based violence intervention programs, such as cure violence programs that have shown to be effective and are evidence-based, and more focused deterrence programs like Advanced Peace, which is out of California, which is shown to has significant results in reducing violence in the Bay Area. But also I would add in terms of accessibility to mental health services, which I think is critical, because again, when you're working with over 700 survivors of violent injury at one hospital and the other you have 1,400, how do you rely on one clinical counselor to provide those services when you're dealing with an entire population that's traumatized? So in terms of accessibility to these prevention services in the community is critical in training people to provide those services that are culturally competent and culturally sensitive as well. But I think we also need to think more outside of the box in the ways that the criminal justice system and the healthcare system overlap. And so State's Attorney Brayboy mentioned that they're working with emerging adults. But what we have that are incarcerated, what we have found in our studies is that the most significant risk factor for repeat violent injury is a history of incarceration. And there's a clear reason why, because the mark of a felony and felony disenfranchisement and laws associated prevent many people from getting a job once they have a felony record. They cannot get legal employment. They cannot get a Pell Grant. They cannot live in public housing. So in many ways, we have to address the other issues and laws that are associated with pushing people back into lives where they're forced, in many respects, to carry a gun. I don't think anyone decides that they want to carry a gun and maliciously hurt anyone else. I think hurt people hurt people. And we have to prevent that level of hurt. And then finally, just moving upstream and dovetailing on Dr. Hodges' comment, before we even arrive at emerging adults were once 10 years old, and right? And I think that we really need to invest in those 10 to 18-year-olds, because ultimately we will see those 10 to 18-year-olds in our trauma centers, or unfortunately, we may see them in our morgues. And so how do we begin to invest in those 10 to 18-year-olds and get them the resources that they need so I will not see them in the trauma center. And then finally, the solutions need to come from the community. This top-down approach of us deciding what's best for the community, in my estimation, is totally the wrong approach. I think we need to have people who have been victimized, have survived violent injury, have the lived experiences of what they know would work because they've been involved in these situations and many have turned their lives around. They need to be involved in the solutions, and they need to be part of the conversations that we're having today, and in terms of interventions and also policy as well, and programming as well. So we need to have a much more ground up, grassrooted approach in terms of how we develop policy. And so I would invest in all of those things.
Right. I'm glad you made that point, Dr. Richardson, about the bottom-up approaches. And we need to be very cognizant of that, it seems to me, when it comes to developing programs, because I think programs will only be as successful as the extent to which they include the voices of community members who are most impacted by them. And sometimes it requires a knowledge, for example, of a grant writing process to be able to access funds. And sometimes, that information is not available, right, to people in a community most impacted. So that's why part of the reason I wanted to have this conversation, because if we're able to make federal funds more available for these purposes, we do really want to structure them in a way that will make a significant difference and reduce, violence and gun violence. So let me, why don't we do this? I'm going to turn it over to Ms. Bannock again, because I think it was, you mentioned the California program as well. Based on what you've seen both in Maryland and around the country, and taking into account this idea that grassroots neighborhood, the neighborhood needs to be involved in help designing solutions. What have you seen that most works and doesn't work? And then I thought what I'd do is I'd make a few closing comments and turn it over to our state's attorney to make some closing comments.
Absolutely. Thank you. No, I think that this investment in the community is so important, and that we need trusted leaders within the community who are spreading this message, right? So if I go into the community, I'm not a trusted, and there's no reason I should be. And I think that one part of this is that those of us who have been in the gun violence prevention movement for a long time need to assume a little bit of responsibility for some of the past mistakes we have made. And there have been perhaps too much of an emphasis upon the punitive approaches to gun violence prevention. And I think we do need a bigger investment in these early intervention programs, recognizing that there are already people within the community who are doing this work. And they're doing it, again, many are doing it without being paid at all. Dr. Hodges, I don't know what your experience was like, but I imagine you start out with 65 kids with a basketball program, moving up to 5,000. There are a lot of people in Baltimore and Prince George's County who have 65 kids that they're doing things with. And if they had the resources and technical support and grant writing assistance, they'd be able to evolve that into something much more meaningful, much more positive, and that would reduce a lot of violence. And I think that we have to trust that communities know those answers. And as Dr. Richardson said, that we are not, we're there to, I think, I need to turn to Dr. Richardson for his expertise and his research to say what's working, what do your models say, but I'm not there to impose anything on a community. I'm there to learn and provide assistance and resources just as much as I am to turn to Dr. Richardson to say, well, what do the academic studies say? And we have to balance both of those voices, the community voice, the research voice, the policy voice, the advocate voice. They all have to be at the table. They all have to be invited. And they all have to be respected.
Well, listen, I want to thank all of you for sharing your insights and your experience and ideas for the best way forward to address violence in our communities. And as I said at the outset, I do think that there are two approaches, and they're certainly not mutually exclusive. We need to be doing both. We do need to be working on these federal laws to prevent, people who are going to be a threat to the community from getting guns in the first place. Criminal background checks and those other kind of checks. I think it's common sense that we would have a universal background check before people can purchase guns. Even better than that are the kind of laws that, like Maryland has in place, the permit to purchase. We want to make it harder for those people who want to buy a gun to do harm, not to get the guns in the first place. But we also need to focus on, what we've been talking about here today. Everything from fundamental issues like making sure that we have universal quality early education, that we have an education system that serves our kids better, that we have availability of mental health, to those broad systemic things, but also, again, providing resources to community-based programs that work at intervention and reducing gun violence. And that is, why I'm, excited about the proposal that President Biden has put forward. We're going to work to try to get those resources so that we can, fund some of the programs that have not been given a chance, but have a good evidentiary basis, and then take to scale and expand those that are successful that we've talked about today. So I really want to thank all of you, because this is very timely. We're in the process now of trying to, shape and structure the funds that could be made available, and I hope they will be. We have to get all that over the finish line here. But with that, let me turn it over to somebody who I've partnered with on issues of public safety, criminal justice reform, and a whole range of other issues. And I'm going to leave it to State's Attorney Braveboy to close us out.
Well, thank you so much, Senator. And this has been such an enlightening conversation. And I wanted to go back to something that Dr. Richardson mentioned, which is, the importance of, really focusing on those who are on the ground, knowing what they want and need. And that's why we initiated Our Streets, Our Future. We brought together about 50 nonprofits that are doing really great work on the ground. We wanted to talk to the people actually doing the work, who live in the communities, who know what interventions work and more importantly, what does not work, and also what's needed, and are not afraid to knock on doors, are not afraid to have conversations between, let's say, rival communities, because that's sometimes what happens here. So we're really excited that those are the people who are actually driving the conversation around Our Streets, Our Future. Our job as government, as I see it, is to create and provide a pathway for those who can do the work on the ground to get the resources that they need, the access that they need, and put them in front of folks like a Senator Van Hollen, who can assist them in growing their capacity. And so I know that Dr. Hodge has been on the ground for over 2 decades. He cares about our community. I've firsthand seen how his program has impacted lives, and none of those young people who've been impacted by his program are out there committing offenses. You know why? Because they had someone in their life that touched them in a way that they needed to be touched. They connected with someone who got them, who felt them. And what Ms. Bannock said was so true, that you have to have trusted members of the community going in to talk to other members of the community. If you look at a community, it's like a family. You can't tell me what to do in my family, okay? Because you are not a member of my family. But if a member of my family speaks up and says, hey, we need to do X, Y, and Z, I'm more inclined to listen to them. And I think that's how we have to approach communities. There are people who've been working in Seat Pleasant, in District Heights, in Suitland, and in some of our most challenging communities for years. But guess what? They are not the programs that have been funded. They are not the programs that have been celebrated. But for the young people that they have been able to touch and connect with, those young people are excelling. So we need to invest in those groups. Many of them are Black and brown. Many of them are headed by people who look like members of the community, but maybe they didn't have the right connections. Maybe they didn't know how to fill out the grant applications, or maybe they just didn't know that those opportunities even existed. Because remember, in these communities that are hardest hit by crime, the opportunities sometimes they don't even know exist. And so we have to ensure that they know that the opportunities exist, and that we can assist them in applying for those grant opportunities so that they can better assist the communities in which they live. So I'm really excited that we have a senator who cares, a senator who's willing to have this tough conversation, and will take this conversation to Capitol Hill. And so we're really excited about that. We certainly invite everyone to join us for Our Streets, Our Future. It's not a moment in time. On June 1st, we had our kickoff. It is a movement. We're having several events, but they're led by the local members of the community where we're going. So we're not going in saying we know what you want. We're going in with partnering with the community, saying, here's what we understand that you need. What else do you need? And I think that's the approach to take. And I think that's what's going to reduce ultimately gun violence in our communities. And I totally agree. We need to focus on our young people. We need to ensure that our young people don't even start down this road to violence. But if they do, which is unfortunately who I deal with, those who end up in the system, I still don't want to throw them away, and I'm not going to. What we're going to do is provide for continued opportunities for restoration, because again, these are members of our community. They are more than likely returning home to our neighborhoods. And I personally care about them, but we all must care about their future, because their future and how well they do will impact how well we do as a community. So it is a tough job, but we are all on this call doing our part. And I think working with those on the ground, we're going to make a difference. And so I'm so grateful to have this conversation and look forward to the work that we're doing. And Senator Van Hollen, if you could thank the President and Vice President on behalf of Prince George's County, we appreciate the efforts that they're making to reduce gun violence and address the real needs in our communities. Thank you.
I will do that. Thank you. And I'm have to apologize to members of the press, because I know that we've gone over time in our conversation. I got carried away. I thought it was a good conversation. I want to thank all our panelists, but we will open it up for any questions at this point in time. And I know we're a little over schedule, but we appreciate your understanding.
So if our members of the media can just either use the raise hand function or put their name and their outlet in the chat, we will call on you and unmute you. And then two, if you can, when we call on you, if you can please just repeat your name and your outlet. I saw Brian first, so we'll go to him. Brian, go ahead.
Hi, Senator. Brian Rembaum, Maryland reporter. How are you this afternoon?
Yes, how are you? Good to be. Thanks for joining us.
I just wanted to ask you, it pretty much right now takes 60 votes to get anything passed in the United States Senate. Where do you see any future gun safety legislation headed, in terms of passage and the hurdles it might, face?
Well, what I can say is this. The good news is the House, as you know, passed what's called H.R. 8, House Resolution 8, that would essentially have universal background checks for people purchasing guns, because we know that's a way to keep guns out of the hands of people who want to do harm. That is, as you indicated, in the Senate. And my view is two things are happening at once. One is there are ongoing conversations to try to get enough Senate Republicans on board to endorse that legislation. But whether we get 10 Republican senators to overcome a filibuster, I don't know. I, as you may know, am in favor myself of getting rid of the filibuster. I think that the great danger to our country right now is in our inability to pass important things like public safety laws, which, by the way, this proposal is supported by 80 to 90% of the American public. I mean, overwhelming public support. But that is also why we've been talking about this other aspect of tackling the issue of gun violence and violence in our communities, which are trying to directly fund gun violence protection programs, but also pass other measures that President Biden has proposed. For example, the American Families Plan would have universal early education, universal. It would also ensure that we have well-funded workforce and job training programs. It would allow everybody to have at least 2 years free community college, and then also reduce the cost to families of four-year college. So those are other really important issues that are before the Congress right now that can impact on the issue of violence. But with respect to the law that I mentioned, HR 8 and other efforts like that, we're still trying to get Republican support, and we're gonna keep at that as we also work on this other approach.
All right, great. And I see we've got a question from William, which Mr. Richardson may have answered somewhat already, but William, I'll let you go again or as well.
Thank you. Thank you very much. I see Dr. Richardson answered a little bit of it right there in the chat. Thank you, Doctor. But if you could, is there maybe something, if you can expound upon that, what it would look like for the community to see firsthand? Thank you.
So I would advise and recommend an approach which would include a researcher to practitioner approach, which I think now the Robert Wood Johnson Foundation and other foundations are funding grants which include researchers and practitioners to work together as research teams to develop the intervention. And so the way that I would envision it is that the researchers would work with the community-based organizations to determine what are the needs. And as many of our panelists have mentioned, that community organizations often may not understand how research is conducted, what kind of databases that you need for a successful evaluation. And so it's critically important to have scholars and academics who understand the evaluation process to be working alongside community-based organizations. And there's more funding available now through foundations and hopefully through the federal government that would support initiatives which would allow partnerships between scholars and community-based organizations to develop these innovative ideas that organizations may have, but they don't necessarily have the technical expertise to execute those ideas and put them into action.
All right. Any other questions, Francesca?
I think that is it. And I know you have to run to go preside over the
I
Senate.
have to go preside over the Senate. And I want to just close again by thanking all of you who are listening and tuning in, and a special thanks to our panelists and to State's Attorney Braveboy. So thank you all for this important conversation. Most of all, what we're all going to do on follow-up. All right. Thank you.